Hello, my name is Jamie Dooley. I am the founding director of the National Network of Healthcare Hygienists, and today I have with me Liz Jinks. Liz is a fellow RDH, and she also happens to be a cancer survivor and one of our instructors on our latest certificate program in oncology. So she taught two modules on pharmacology for the cancer patient for us. Just a little bit about Liz before we get started is that she began her dental hygiene career in 1981 at Parkland College. She first began her career in private practice and began teaching shortly after. She quickly realized how much she loved to share her knowledge and experience with others. This ultimately inspired her to complete her bachelor's degree. During her time at Parkland College, Liz taught several courses, including head and neck anatomy, local anesthesia, pharmacology, preclinic, seminar 3, and many laboratory courses. Wow. One of the most memorable highlights of her professional career include receiving the Part-Time Faculty of the Year award. Her career in teaching has always been fulfilling and truly rewarding. So thank you, Liz, and welcome.
Thank you for having me. I'm so excited to be here.
I'm so excited too. I just thought it was really important as both a dual oncology patient and RDH to go into a little bit about why we created the Oncology Certificate Program in the first place, how oral health and oral care is largely just missing in most cancer treatment facilities, and how we can help to be the bridge as hygienists, and talk a little bit about your journey.
Okay. Well, I guess I can start when I discovered that I had cancer. It was December of 2017. And a couple months before that, I noticed something that was kind of changing in my breast. And so I had just had a mammogram not that far back. And I finally went in and they discovered I had invasive ductal carcinoma. So when I heard that, I was pretty upset. My whole world stopped at that point. And I had to, go through quite a few tests. And I guess it was probably about the middle of January of 2018 that I started my chemotherapy. The type of cancer I had is a triple positive. So I was HER2 positive and estrogen and progesterone positive as well. And those are the receptor sites that were on my tumors. Or actually I had a little, I think it was 2 centimeters, and the other, I had a tiny one that was a little branch off of it that was, I think it was about 3 or 4 millimeters. So I was very, very upset when I heard all of this.
Yeah.
And so the plan was set that I was going to go through chemotherapy and also immunotherapy as well. Chemotherapy along with the immunotherapy lasted for, I had they call it 6 rounds of that. And I had a 3-week schedule that I was on. So I had my chemotherapy and then I had the immunotherapy. And that usually took from about 8 o'clock in the morning until I usually left about 4 o'clock in the afternoon. So it's quite a long process. And then after I completed that, they gave me about a month off, and I had then surgery, and I went and had the lumpectomy. I was able to just have a lumpectomy, and then I had another month off, and then I had radiology or radiation therapy. I'm sorry, thinking of radiology lab. Radiation therapy I had for 4 weeks, and it went Monday through Friday. And at that time, I also started taking the aromatase inhibitor, which I am postmenopausal, but because my cancer was hormone positive, I have to take that for 5 years. And I have 6 more bottles to go through because it's almost going to be 5 years in June since I've taken that medication.
Well, congrats, you're almost to the end.
Yes, I'm almost to the end. And so it's been quite a long journey. It's not something that goes, get done in a couple of months and you're done and over with. It's usually kind of a longer process. And so along the way, I went into it scared, very, very frightened, because I really understand how cancer works, just teaching and also teaching pharmacology. I really had an understanding of what I was going to be going through. I did learn a lot, and even doing the research for the presentations that I created, I learned a couple of things as well, like, oh, that's why I had to do that, or this or that. So it was quite a long process, and I went into it very frightened, but I came out of it okay. And chemotherapy and the things that you go through is not quite like it is, or how you would think according to when we see it on the movies and this, that, and the other, it's not quite as dramatic. So yeah, it was a long process, but I'm almost on the other side. It'll be 5 years since I started chemo in January. So
Wow.
yeah.
Well, thank you for sharing that story. I mean,
Yes,
it sounds like you definitely were blessed to come out the way that you did,
I
but
was
still
very,
really scary, very
yes,
emotional.
it
Um,
is.
Tell us what it's like to sit in the chair getting chemo for, that long.
Well, yes, it's the first time is quite frightening because you're not quite sure how your body's going to react. A lot of times they will start you with several different types of medication before you begin the chemotherapy. There are drugs such as anti-nauseous medication that they will give that to you initially, and usually Benadryl, so you don't have an allergic reaction, and also corticosteroids. And that's not only just for inflammation, but it also helps reduce nausea, which I didn't realize at the time. And also, I do know this, it does increase your, it increases your appetite. So that kind of helps you stay eating, especially when you don't feel that good after going through chemotherapy. And it's a long process. And before I actually went in for my chemotherapy, before I started, I had to have a port placed in my chest. And that was quite an ordeal as well. It's just like a week before. Sometimes it gets placed a couple of days before, and then all of a sudden you're in the chemo chair. And but I had a lot of support. I had my husband; he came every time, and I had friends that would stop by and to check on me. And I think if you have a really wonderful support system, you can definitely get through it. Also, the oncology nurses are fantastic as well. So, but it was quite frightening, yes. And then after you get used to it, you realize what you're going to go through and what it's like. After the first treatment, the rest of them weren't so bad. So, and the immunotherapy, even though I had to continue that for a whole year, immunotherapy wasn't so bad. There were a couple of side effects, but it wasn't anything like chemotherapy. So,
Well, it sounds like you maintained a really positive attitude throughout the whole
yes,
thing, and that you had that strong
had
support
to.
system,
Yes,
which was wonderful too. So you mentioned that the nurses were great. Let's touch on
yes.
that.
Okay.
I know that from some friends who have gone through cancer treatment that oral care and oral health discussions are often non-existent. What was
Yes.
your experience like?
My experience with the oral cavity when I went in to just go through kind of an orientation before I started my chemotherapy, they really didn't touch on that. Not at all, actually. And I was waiting for them to say something. There was only one time that I had some slight, ulceration in some of it was, oh, it was very slight on my upper right quadrant, and I knew what it was and I knew what to do with it, but they really and truly didn't talk about it, which was really kind of sad. And in fact, I did read a brochure that said something to the fact that if you have dry mouth or xerostomia, just go ahead and use some lemon drops to increase your salivary flow. And I thought, oh dear, now that's not a good thing to say.
Oh, in a
You know,
brochure?
so of course I brought that up, and it's
Yeah.
been changed. It has been
Hopefully they threw
altered.
those in the
Yes,
garbage from
thank goodness.
1982.
Yes, yes. So I
Oh,
was like, oh my goodness. And I think there were times that I thought maybe I got the feeling that they don't address some of these things until it happens. Because I almost had the feeling like they must not want to talk about certain things that could possibly occur because they don't want you to worry about it. That's the feeling I had at times. And also, interestingly, when I had to have the bisphosphonate infusion just last April, I know what all can happen with that.
right.
So, of course, when I went in, I had to ask, and they said, "Oh, it's usually not a big deal." But I said, "Well, are there any things or is there anything I need to think about?" No, no, it'll be fine. So that wasn't even addressed, and I understand. It's just maybe it's just not something that's very emphasized. So, but I know, and
Yeah.
my oncologist, he always would kind of tease me. It's like, now, Liz, it's about time we give you an infusion of that because I do have some osteopenia, just the initial breakdown of some of parts of my anatomy and my bone area, I guess I should say. And so I've kind of been pushing that off because, if you're having it done infusion wise, the risks of having, osteonecrosis actually obviously it's very large, can happen very easily. So, but
Yes.
so far I've only had to have one. So
So unfortunately, you received no instruction
no,
on why your oral health and your
right.
oral hygiene at home just became even more important as
Absolutely.
a cancer
Absolutely.
patient going through treatment. And you also, when you did have some mucositis beginning, didn't receive any
Yes.
tips on how to manage it.
No.
And my friends who have been through cancer treatment have told me the same. The one
Wow.
person with severe oral mucositis was given the magic mouthwash recipe, and
Yes.
that was that.
Yes.
There was no other assistance, and not even a thorough dental exam or
Right.
oral exam
Exactly.
prior or during or after.
Exactly.
Oh, so that's
Yeah.
why
And
we're doing what we're doing.
I think it's fantastic because when it has to do with the mouth, there are people that have such extreme mucositis to the point that their life is so altered that they cannot continue treatment. And that can bring on a lot of problems as well. You stop chemo treatment or chemotherapy. Sometimes your cancer can become, what I want to say, it becomes resistant to the chemotherapy, perhaps later on. There's so many things that can really alter your progress if you're not able to continue your treatment. So I know how important it is.
I watched a video from an oncologist, and I can't remember his name. It's on YouTube, and he ended up with the one of the worst cases of oral mucositis going through treatment himself, and
Goodness.
he hid it.
Oh
And
my.
then he made it his passion, and so
Wow.
PBM laser is one of the things that he's
Sure.
suggesting as a prevention and treatment protocol,
Yes.
which
Just
of course
even just knowing the prevention is so important.
we do
Absolutely.
include in our course as well. I
Yes.
also wanted to know, as a dual patient and RDH, what do you think is needed in oncology treatment centers as someone who has sat in that patient, side or setting? If someone from a cancer treatment center was listening to this interview, what would you recommend? Would you recommend they have a hygienist on staff? Would you recommend, that their nurses are trained? What would you recommend?
It all depends on the, oncology department, whether or not they would, include having a dental hygienist there to educate patients. In a perfect world, I would love to see dental hygienists working in an oncology department. Again, like I said, if the mouth is not healthy, you can't maintain healthy, eating habits. You can barely swallow. You can barely speak. All of those things can be so detrimental for the patient. In a perfect world, yes, it would be wonderful to have a dental hygienist in there to educate a patient that's coming in, going through what to expect, what chemotherapy is going to be like, perhaps for them. They basically talk about the mucositis from the throat down,
Right.
but they don't talk about it obviously in the
They
mouth.
just skip a whole section.
They skip, and that's so part of your body. Hello, it just surprises me. And the other thing too, perhaps if that's not something that's attainable, then nurses obviously should have more education when it comes to what happens in the oral cavity. Absolutely. So that would be my recommendation for
Well,
sure.
thank you
Yes,
for
and
that. And that is it seems to be the consensus of all of our instructors and all of our board members at an
absolutely.
NHH, that the ideal here would be to have one hygienist on staff in
Yes,
each large healthcare system that has oncology
yes,
treatment. And then that hygienist, depending on supervision laws, might be clinical, might be doing a prophy, an assessment,
sure.
communicating with an oral surgeon before
Yes,
treatment begins, helping them out and caring for them during treatment. And then again, a really thorough cotton method form of screening where you're looking for any head, neck, oral pharyngeal
absolutely.
cancer for a
Yes,
follow-up amount of at a minimum 6 months, if not a year. There should
yes.
be a standard created, and we're working hard to create that.
I completely agree. Absolutely. It's such an important addition to be placed in an oncology department. I totally agree.
And at a
And I hope
minimum,
that's,
yeah,
yes,
at a minimum to be an educator. At a
yes,
minimum, because unfortunately some state laws have our hands tied, but at a
I know.
minimum, a hygienist that comes in and takes our certificate program would feel empowered and knowledgeable enough to go in
Yes,
and at a very minimum, educate the providers.
Absolutely.
And as you
Oh,
and I
that'd be
both
so
know,
great.
nurses have way looser supervision. So
Yes,
oftentimes in some states, we cannot even hold the PPM
I
laser.
know.
The nurses, the MAs sometimes can, I've heard. Now, I
I
don't know if
know.
that's
It's so
true.
frustrating.
It's
It
so
is so
frustrating,
frustrating.
but it's not going to be a reason for us to stop. We're going to keep
No,
going anyway because there are patients suffering.
yes, there are. And patients that aren't able to complete their treatment just because their oral cavity is in such poor shape. Yes, it just makes me so sad. And that's why I'm so excited to be part of this. I'm so excited I was so happy to participate in the program. And I hope that, what I've spoken about will make a difference as well.
I guarantee that it will. It's already made a difference for me. It's already given
Oh,
me chills and made me so glad that not only
oh,
did we push ourselves to put this out, but that we also found
yes,
you and
I'm
we're
so
lucky enough to
excited.
have you as an instructor.
Oh, well, thank you so much. I just appreciate the opportunity. I think it's fantastic. And I think that the students that take these courses are going to have so much information and be able to educate patients and other healthcare providers as well.
Thank you so much, Liz. If you are more interested in what the National Network of Healthcare Hygienists offers, we can outsource your dental hygiene education. If you're interested in hiring a hygienist for your facility,
Yes.
we have certificate programs in areas of medicine. And so you won't
Okay.
have to worry about that missing gap. Go to
That would be awesome.
go to healthcarehygienists.org.
Yes.
And I'm
Okay.
sure, depending on where you see this video, you'll find the link below. And thank you, Liz, today for being
Okay.
with me.
Thank you so much for the opportunity, Jamie. Thank you.